Ladies and gentlemen, good afternoon, good morning, and good evening to you all. And welcome to the 8th episode of the Space Generation Advisory Council webinar series on health in space. This episode is all about surgery in space. My name is Jules Lancet, and my guests of today are Jay Buckey and Eleonor Frost. And again, welcome back to our series. Of course, venturing out into deep space will give rise to new challenges, not only to the technologies used, but also to the human element in this type of journey. Our bodies and minds will be put to the test when we travel to Mars on a 3-year return journey, or even in the next human missions to the moon. And today we will talk about the medical needs of such a long-term mission, and more specifically, what if we need to perform surgery in space, on the go, with no one to help? My guess is that in deep space, this will prove way more challenging. Will the astronauts do it themselves? Will they use augmented reality to guide them through, or have a surgery robot on board? Or will it be less science fiction-like, a more quote-unquote down to earth? What developments in technology can we expect? And how will we train astronauts to deal with these medical needs on their way to the red planets? It's a topic of great interest to medical doctors, engineers, and other space health enthusiasts. And we invited two of the experts for our episode today. It was a topic of great interest to you as well, our audience, as we received over 300 registrations. I will introduce our two speakers now. Then after their introduction, I have a little housekeeping announcement. And then finally, we'll start with their presentations. So today we'll hear from Jay Buckey and Eleonor Frost. Jay Buckey was the payload specialist astronaut for NASA on the Neurolab Space Shuttle mission STS-19 in 1998. As a medical doctor, he successfully demonstrated many surgical techniques on board that mission, including general anesthesia, wound closure, wound healing, hemostasis, control of surgical fluids, and control of surgical instruments. After leaving the weightlessness environment, he became the medical director of the hyperbaric medicine program of Dartmouth Hitchcock Medical Center, and he's also a professor of medicine at the Geisel School of Medicine at Dartmouth. After Jay, we will hear from Eleonor. Eleonor Frost is a medical student at the University of Aberdeen, specializing in aerospace medicine. She is part of the Space Generation Advisory Council, where she's the vice lead of the Space Medicine and Life Sciences group that is organizing this webinar series. Eleonor is an amateur triathlete and spends much of her time as a space and STEM ambassador. You can follow her on Twitter via the handle @astrosurgery. As part of her studies, she worked on the space surgery device to allow to perform some medical procedures in the weightlessness of space, which I'm sure she'll tell you all about. And we'll get you to Jay and Eleonor shortly. But first, a few housekeeping items. You have been muted upon entry to avoid background noise and disruptions. And this session will be recorded for later viewing. This webinar, as it is a feat of engineering, is not comparable to anything being accomplished in space. However, this is still a global effort, with your speakers and moderator being in 3 different time zones already, not counting you, the audience. Of course, we are not counting on any disruptions, but Murphy's Law does apply. In that case, please bear with us as we try to restore the live session as quickly as possible. And finally, feel free to use the chat box during the presentation for questions and comments. During the Q&A part at the end of this session, I will ask your questions to our speaker. And I'd like to remind you that our speakers can't get into personal health questions about astronauts. Other than that, I encourage you to post your questions in the chat box while following the presentations. Now, I have been talking a lot. Let's get to our first speaker, former astronaut Jay Buckey. Hi, Jay. Thanks so much for being with us today. I'll be switching over to you now, if you don't mind to share your screen. I'll stop sharing mine. I really appreciate you doing this, and I'm very much looking forward to hearing about your research in the field, and the virtual floor is yours.
Well, thank you. Thank you, Jules, for inviting me, and I'm happy to be here with Eleonor, who is the new generation of people looking at space surgery. So as you know, people who go into space are pretty healthy. So not a lot of time is spent doing surgery in space, but there have been some efforts at the procedures and the techniques that you need in order to do surgery in space. And so what I wanted to just start out with is just to review what's been done so far. You know, what kind of surgical things have been done so far in low Earth orbit that might be relevant to later on when people are going to be going to Mars and be in space for long periods of time. And you might have to do surgery on someone in space. So what I'm going to talk about is the experience from the Space Lab program. And the Space Lab was a module that fit in the back of the payload bay. And you can see in the picture here, that's the Space Lab module. It connects back to the shuttle through a tunnel. And there were three missions in particular: Space Lab Life Sciences 1 in 1991, Space Lab Life Sciences 2 in 1993, and the Neurolab mission from 1998, which is the one that I was on. All had some very detailed dissections and surgical procedures that kind of gave a hint of what it's like to be doing surgery in space. And I'm sure Eleonor is going to talk about more of this later on. So the Space Lab missions were dedicated life sciences missions. So they were all about biomedical science. And they had various human and animal experiments. And part of these experiments were doing things that might prepare the way for future surgery in space. So there was medical restraint systems, things that you would need to strap people onto if you wanted to sew up a cut or to get something out of somebody's eye. IV pumps, you know, the things that you would need in order to give people fluids if they needed fluids while they were in space. And there were also intensive animal dissection and surgical procedures that were done on these missions. These missions were equipped with what was called the General Purpose Workstation, which was a glove box where you could put your hands inside and do procedures inside the workstation without the fluids and all the other material coming out into the cabin of the spacecraft. So there was a lot of this that was done on these Space Lab missions. And I'm just going to take you through some of the things that have been done in the past. So this is a picture. This is from Space Lab Life Sciences 1. And that's Tammy Jernigan, who has Sid Gutierrez strapped down to the medical restraint table. So this was one of the first, well, I guess one of the first. I think they had something similar actually back in the Skylab program. But this is a medical restraint table. The idea is where you would strap somebody down in order to allow you to do procedures on them. And in this case, I think Tammy is just looking in his ear. But you could use this medical restraint table if you were going to do a surgical procedure. And then this is from the STS-80 mission. It actually shows Brent Jett trying out CPR on John Blaha, also on the medical restraint table. So they're testing out the medical restraint table and trying to figure out what are the best procedures to use to do CPR in space. And there have been a fair number of different techniques that have been looked at. In this case, you know, trying to push down on him. There are other ones that recommend you approach from behind and and pull back into the person in order to do CPR. So this was one of those CPR studies in space. And this is a picture from 2010, which shows you the kind of medical equipment that at least was available for shuttle and also space station missions. That's the restraint table out in front there, which is a foldable table and has a head strap and allows you to secure somebody so you can do procedures on them. You can see there's a defibrillator there, then a series of different kits that give you vascular access, allow you to deal with small cuts and lacerations. Certainly not a full surgical capability here. This is just this is more sort of first aid to maintain people in space. So however, the other missions that we're going to talk about, there are a lot of different little procedures that were done. Tail vein cannulation. I don't know if any of you have had the opportunity to put an IV line in the tail vein of a rat, but it uses a little tiny 27 gauge angiocath needle in order to tap that vein and use it to draw blood. So this is a procedure that was done on the Space Lab Life Sciences 2 mission. I was an alternate on that mission, so I trained to do the tail vein cannulation, which is it's kind of like what you use for doing IVs on babies. The other was time dissection of the temporal bone. So there's a lot of interest in space medicine about what happens to the inner ear, the balance organ. And the balance organ is in the temporal bone. And so there were these experiments that were looking at the adaptation of the balance organ. And so to do the work they wanted to do, they needed to put that temporal bone into a fixative within 2 minutes. So the procedure involved being able to do this dissection, get the temporal bone all within 2 minutes. So it was not just doing the procedure, but also having to do it as fast as you possibly could. So that was another one of the procedures that was done there. One that we did on the Neurolab mission, and this is something that Dave Williams, who came to talk to you previously, I guess he didn't mention this, but he was an expert on this, which was a timed laminectomy. And what that is that's accessing the spinal cord, which is inside a bony canal. So in order to get to it, you have to be able to remove the bones that are in the way of the spinal cord, and then allow you to remove the spinal cord. So that was done, had to be done quickly. There were various dissection procedures that were done. We also did what's called perfusion fixation, which is relevant for the future because what we're doing here is we're putting a fixative like formalin, something that is going to preserve tissue. And it's like, and in this case, what you're doing is you're having the heart distribute that fixative throughout the body of the rat, and the anesthetized rat. And so this involves large quantities of potentially toxic fluids. And so in order to do this, you need to be able to not only, get this fixative into the heart, but then you have to make sure you don't spread the fixative all through the workstation out onto the cabin. And so working out all the ways to handle fluids, in particularly toxic fluids in space, was something that we did for the perfusion fixation experiments. And then there was a survival surgery, and this was on all of this is on rats, which was something that I did. And in this experiment, they were looking at the nerves that go to muscles that tend to shrink in space, the so-called postural muscles. And to do this experiment, it involved finding the soleus muscles, which in a small rat, injecting it with a small amount of tracer, and then closing it, and then having the rat recover. So this was something that was kind of a fussy procedure because you're doing it at arm's length. You needed to use some magnifying loops, and then also it's really tiny. We're talking about microliters of stuff that we're injecting and into a muscle that's also extremely tiny. So there were a lot of, challenging procedures that were done on these missions. Just show you what that looks like, how that was done. This is the inside of the workstation, which is called the GPWS, or General Purpose Workstation. You'll see in a subsequent picture that it has a front that has two holes where you put your hands in, and it also has what you can see off to the side here. I don't know if you can see my cursor, but that's where another person sits at the side. And you can see the whole thing has Velcro on the walls. And then down here are some syringes that are used for injections. There's some dissection tools. There's a dissection table, which is a cork board. There are sharps containers for containing the sharps, and then a bunch of other materials that are all secured with Velcro throughout the workstation. And then in the back, this was the trash area back here. So a fair amount of thought had to go into putting all the stuff into this workstation so you could do these experiments, which were somewhat complex. And here's what it looked like when it was fully outfitted. You can see here's someone at the front window, got their hands into the glove box. All the material came in these foil packs. And you can see we have different vials that will hold tissue samples that have fixative in them. We have a gauze, and everything secured around the walls of the workstation using Velcro. Here's our crew here in the back. That's Rick Lenahan, who is our payload commander on the mission. Here's Dave Williams, who came to talk to you, and you can see he's wearing surgical loops for working inside the workstation. And this is Jim Pawelczyk, who is also a payload specialist on the mission. And so we train, this is before the mission, where we would train in a mock-up of the Space Lab module to work through all these experiments, because the two of us would be working together at the same time with all the stuff laid out within the Space Lab module to work through these procedures in space. Also, we practiced these things in microgravity before we went. This is that workstation, the general purpose workstation on the KC-135 parabolic flight aircraft down at Johnson Space Center. So after we got a lot of these procedures worked out, we practiced them in weightlessness on the KC-135 flight to make sure that they were all practical and could be done. And then here's what it looked like when you're inside working inside the workstation. You can see here's someone in the front with someone else on the side, getting syringes off the wall. All the tools here, you can see this is a Velcro strap across this table, and every instrument has some Velcro on it so that it can, when you take the instrument, you just don't let go of it. You make sure that you secure it back to the Velcro so that you can do things in space without things floating around within the workstation. And then again, all the other materials that you need are attached around the walls also with Velcro. You might wonder what's going to happen with the fluids. The fluids will form a ball, and you can just wick them away with some gauze, and so it doesn't. The fluids tended not to be that much of an issue as long as you were thoughtful about it and made sure that you had a way to wick them away. I mentioned the perfusion fixation, and that's what this is here where the workstation is set out to do that. Back in the back wall, those are two pumps that were used to pump the fixative, and then we would collect the fixative with gauze, and then do dissections within this workstation. And you can see we're both wearing the surgical loops there in order to do this work, because you're kind of at arm's length and working with small things. So one of the question was, how did people feel about their dexterity? One question that often comes up, they say, oh, how are you gonna do as a surgeon in space? Would you be clumsier? Would you not do as well because things are weightless? And so we asked people to respond on a 5-point scale. So 1 is strongly agree and 5 is strongly disagree. And just asked them 3 questions. My dexterity was not changed. And you could see that most people agreed to that late in flight, but not as much early in flight, suggesting that there is a little bit of an adaptation that goes on. That initially people have a little bit of trouble getting, adapting to the new environment, but then they seem fine later on. And that says my fine motor control was not changed in spaceflight compared to my terrestrial experience. And most people agreed with that, but again, with a little bit of a difference between early in-flight, again, suggesting that there's a little bit of an adaptation that has to go on when you're initially weightless to get used to working in that environment. And then it was no more difficult to control instruments in spaceflight compared to my terrestrial experience, and people were pretty neutral on that. My own personal feeling is that we practiced this so much before we went that we were pretty good at knowing how to use the instruments and making sure that we controlled where they went at all times. So we weren't learning how to, keep control of the instruments for the first time while we're in space. It may be a little bit different for somebody who's called upon to do surgery who hasn't actually been doing that for a long period of time. That may be a little bit different for them. So if you're interested in learning more about this, we did put out a book about the Neurolab Space Lab mission, and it has a chapter in there about the surgery that was done in space and some of the equipment and procedures that were done. And so it's all available in that book. So basically, just a little bit of a summary from our Space Lab flights that hopefully sets the stage for what Eleanor is going to talk about. But surgical techniques, we obviously did surgery on people, but surgical techniques were successfully demonstrated on rats during spaceflight. And these included general anesthesia, wound closure, wound healing, hemostasis, meaning be able to stop bleeding, control of surgical fluids, and also control of those other fluids that we had, that fixatives. Restraining people, I guess I should have talked about that more, but as you can, we had to make sure that you have good places to put your feet and also to strap around your back so that you could work in that workstation easily, and control of surgical instruments. But also looking ahead, as far as doing delicate surgical procedures, that's been done. We did a lot of pretty fine work with on Neurolab, and so it certainly seems like, as far as being able to do little complex surgical procedures, that really should be possible with the proper training and equipment. And that ACLS procedures, advanced cardiac life support procedures, have also been worked out in space using different equipment. However, unfortunately, that hasn't ever had to have been used. And so I'm going to stop it there, and we can go ahead and move on.
All right, thank you, Jay. This was a great overview of space surgery research and its impact on human space exploration missions and some of the challenges we are currently dealing with still. It certainly put space surgery in a new perspective for me, and literally as well, thanks to all those pictures that you showed, which was very insightful. I'm sure there'll be lots of questions about this that we will save for the end, where Eleonor and I will discuss this with the audience, as you have to leave us today for other appointments to attend to. But before you go, let me thank you for your fascinating presentation. It was a very interesting talk, and also a good basis to further on our conversation. So I'd like to thank you very much for taking the time today.
Thank you. Thanks. Great to be here.
Thanks. Have a great day ahead.
All right. Well.
Bye. Next, we will be switching to the UK, to Scotland, to Eleonor Frost. Hi, Eleonor. Thanks for being with us as well today. Eleonor and I are in the Space Medicine and Life Science group of the SGAC. And now I gather you have more to share with us from your research perspective and your experiences while you developed a space surgery device. So I'm looking forward to hearing your presentation.
Great, thank you. I'll just start sharing my screen. Is that?
Yes, we see it. Great.
Can you see the slides there?
Yes, we do. Thanks.
Okay, perfect. Okay, so thank you so much for the introduction. I'll just get started, and today I'll be talking about space research in general and the kind of considerations that have to come into play, but also my work in designing a surgical workstation and all the questions that come with that. A little bit more about me. So I actually did a bachelor's before my medical degree in physics and medical physics at UCL. And that's where I got to do a module in space medicine and extreme environment physiology. And it's where I did my dissertation, which you can see on the right, which was on this microgravity surgical workstation. And then I worked for a year at ICET, which is the International Space School Education Trust, developing some experiments that we worked on and launched the ISS in March 2020. So I'll be starting with those just as a good segue into the kinds of questions you ask when you send things to space. And I'm currently in my first year of medical school. I've gone back to university and I'm up in Scotland. So the main message that I wanted to get across with this presentation really is that there's space for innovation, if you don't mind the pun. But if you're a student and you have an idea, I'd encourage you all to run with it, because these opportunities just come up. If you have innovation and you think of something, then propose them and try and get some help out, because I never thought I'd be able to design a surgical workstation for my bachelor's, and eventually I got there. So the content of this talk will be addressing the challenges of science research in space, and that's through my work with ICET, and then some of the challenges and considerations in space surgery, which Jay has already sort of touched on, but we'll be trying to find a solution to those. When I was trying to think about how to summarize space research, I came up with the fact that it's really all the same challenges as scientific research, and then you just have to add the spice of microgravity and the NASA requirements, which can be quite stringent, unfortunately. So starting with those, here are some of the experiments that we had on the ground for ICET. So they run a mission discovery, which is where students come into the labs and they can essentially propose the experiments that they think they want to send to space, that they think is an interesting question to ask, and they compete against each other. And then the winning experiments we develop throughout the year and then launch to the ISS, and we get to send them the results, which is also really exciting. Two of the experiments here on the top left, you can see we had some agar plates with E. coli and Staph aureus, and then we were testing how they would react to different antibiotics in microgravity. And then the vials that you can see were filled with vitamin C, and then we were injecting a dye at different points throughout a space mission to see how vitamin C degrades in space. So as you can see, they're quite simple experiments. They're definitely interesting questions to ask, and it's always great to feed back to the students that their experiments have flown to the ISS. At the bottom, I put some of the questions that came up while we were doing our work. And as Jay mentioned, the fluid behavior is very different in microgravity, and I'll be going into that a lot more, but essentially surface tension dominates because there's no gravity for it to compete against. There's also equipment changes. So all of our experiments had to be in these plastic pouches because so we were sending it with the operated nanoracks, and they didn't want the astronauts to come into contact with anything that had been sent up from the ground that they hadn't sort of worked with. So we put them in these plastic pouches, and that's how the astronauts were going to interact with them. The sort of question that came up that we hadn't really anticipated was how to get live specimens across specifically the US border. Some of our other experiments had planaria flatworms and larvae and that kind of thing. And it was definitely very difficult to get permissions to cross those. So I think a lot of them we ended up just ordering in the US and setting up on the Space Coast ourselves. Launch delays are a big thing in all space research. I think our launch was delayed about a week or 10 days. So you have to account for that and the fact that your experiments are going to be kept in the cold storage for that amount of time and sort of sitting at the top of a rocket for that amount of time. The other consideration as well, as soon as you're sending things up to space, is that the rocket can fail and you might lose all your experiments if it blows up on the way up. So always having some kind of redundancy definitely helps. Ground controls, we were trying to get our ground controls to mimic the conditions as much as possible. So we even tried to copy the sort of vibration that they'd be going on the rocket, and then the cold storage sort of amount of days that they were there, and then they'd be taken out. And all the experiments on the ISS were just kept at room temperature. So again, you'd have to stabilize your experiments for that. Tools on board the ISS are quite limited. It depends what operator you're working with and what kind of data you're wanting to get back. But we just had the astronauts taking pictures, either using just a normal camera or a microscope of our experiments. And I'll be showing you those a bit later, but you'll see that it really depends how they take the pictures, whether your data is more clear or visible than else. So it's really about giving clear instructions, because the astronauts don't know the experiments sort of very well. So you just have to give them instructions. Move on to take, sorry. So these are our experiments up on the ISS. And it was really cool to get the pictures back, but as you can see with those plastic pockets, it's not always very clear. You can't always see all of the detail. You can get your experiments sent back. I think ours was just burnt up on re-entry, but you can get return experiments as well. It just depends on the organization you have. Now, moving on to surgery in space, the two big questions are why and how. And the first question, why, I think Jay touched on, but essentially if we're going to be going on missions to Mars, those are going to be 3 years long total. And then if you need a emergency evacuation, you've got 9 to 12 months to get back. So you're definitely going to need some autonomy. The communication delays as well will mean that astronauts will not be able to rely on the ground as much as they have on the ISS. On the ISS, they can sort of get to a hospital within 6 to 24 hours. So it's not really a consideration that you're going to have to do any surgery on the ISS. And again, a lunar base is 7 days return, so you could also still get an astronaut back if you needed an emergency. But the NASA analysis puts the risk of a serious medical event at 1 event per 2.8 years of spaceflight. So if these missions are going to be 3 years, then that's pretty much 1 guaranteed serious medical event. And in terms of the idea of how surgery in space, that's what I'll be presenting next. And so my design was essentially really just a glorified glove box, but I'll be taking you through the process of designing it and showing you a few of the considerations that came up so that if you were trying to innovate in space, then you can run with those ideas too. So the project aims, the first was really to assess the feasibility. First of all, whether I, as a student and bachelor student, could really design a surgical workstation without some of the expertise that comes from years of doing experiments in space like Jay. But through the literature review, it's definitely interesting to see that quite little had been done on the exact solution to how to perform surgery in space. As Jay mentioned, they've done a lot of experiments on the fine sort of dexterity and whether the surgery can be performed, and those are very positive. So the next step would really be finding a solution as to how to perform the surgery in space. And there have been a few proposals, but I just felt that there was a gap for me to try and fill with my idea. The design, I really started off with a very basic initial idea, which was this sort of glove box. And then I'm going to be talking a little bit more about how I was thinking about the fluids containment. That's where the idea started from. But all those 3 things came into my phase of work. So I had my initial design, I did my research literature review. I was also fortunate enough to get a lot of feedback from experts in the area, and then perfected it into my final proposal for my dissertation. Next, I just thought I would share a little video because this really demonstrates the behavior of fluids in space a lot better than I can explain it. So hopefully you can hear the sound.
Okay, so here's a soaking wet washcloth. Get the microphone so you can hear me while I'm talking. And now let's start wringing it out. It's really wet.
So as you can see, surface tension is dominating. There's no gravity for it to work against. So fluids behave in a very interesting way. And I just, to talk about the surgery side, Jay mentioned these, but the arterial blood, because it's exiting the wound at quite high pressure, will form these arterial streams. And of course that needs to be controlled, otherwise you'll keep bleeding. But the venous blood is actually quite easy to control because it just forms these domes when it has just one surface of contact and it's not high pressure. So you can just sort of wick those away, as he mentioned. Now, one of the defining principles of my own glove box was actually something called the capillary fluid effect. And this was used to design a coffee cup in space, but it also originally comes from the design in the fuel tanks. And this capillary effect I was hoping to harness to control fluids in space and make sure that the surgical field was available for the surgeon to keep visualization rather than having blood in the way, essentially. So let's see if this video works. No. All right, the video is not going to work, unfortunately, but as you can see, the cup is kind of shaped like an airplane wing, and you've got liquid that's going to wick down the middle, and that is because there's two surfaces of contact, the liquid's going to run along that rather than pool at the bottom. So I just thought I'd simplify two parts of the project that I went through. Really was the factors that are affecting the surgeon and the factors that are affecting the patient. So if we start at the top and go clockwise, one of the really important factors that came up is that the cabin bacterial colony counts are actually 10 times higher than a standard operating room. So you've got a really high risk of infection if the wound is exposed to the cabin sort of atmosphere, and that's why the idea is to keep it separate through the glove box. Next, the surgeon will also be floating. So you're going to be destabilized. It's not really going to be like a normal operating theatre. But as Jay mentioned, just with some foot restraints, that seems to have been solved, and they feel they have enough control and dexterity. And then the laws of physics do still apply, even though they might seem like they act a bit weirdly. So every action has an equal and opposite reaction. So even when you're removing your gloves, sort of anything that's on your gloves can come up and float off into the atmosphere of the cabin, which is not ideal. Down on the bottom right, as you can see, this astronaut's wearing glasses, and that's because of this fluid shift. A lot of astronauts develop some short-sightedness, and that's not fully understood yet, but some of them do have to start wearing glasses. And obviously you want your surgeon to have the best visualization that he can, or she can. In the middle, we've got astronaut Chris Hadfield's demonstrating things floating around in microgravity. In the context of surgery, that does mean that your tools will be floating around if you don't keep track of them, and it's definitely a consideration. And the same thing on the left as well as the safe removal of waste and contaminants. You don't want things floating around, particularly if anyone's been in surgery. You can see all sorts of things being put aside, and you don't want those floating around the cabin and possibly infecting other crew members, or just increasing that bacterial count, which is already quite high. And then finally, unfortunately, with the communication delays that there will be with Mars, there won't really be any option of telemedicine, not in real time anyway. And so you won't really have the option to phone a friend or get any sort of robotic assistance that might be controlled down on the ground. Factors affecting the patient. On the left is just a little animation, and it's really to demonstrate the fact that astronauts are actually at 10 to 20% reduction in blood volume. So that's called a hypovolemic disadvantage. But as you can imagine, if a patient is already at a hypovolemic disadvantage and they start bleeding more, it's definitely something you want to control a lot faster. And that interplays as well with the muscle and cardiac atrophy and the loss of bone mass that we see in astronauts on the ISS currently. And that's on 1-year missions, but we're of course sending them away for 3 years. So there's not much known about the effects that can have on a patient's recovery, and that's quite a big question. And finally, some of the astronauts have shown some immune changes. And those aren't fully understood. As you can see, there's a lot of questions within the space medicine area. But again, if your patient isn't able to fight off infection as effectively, then there starts to be question as to whether you should really operate. Another big question is partial gravity. So a lot of the work we do on the ISS is, well, all of the work we do on the ISS is in microgravity, but when we get to Mars, we will have partial gravity. So we still need to do a lot of research on how that affects both the body, but also that fluid behavior that we were talking about. And so there's a lot of space for research to be done. This is quite a busy table, but it's really just to show you the kinds of things that are predicted might happen during a Mars mission. So on the left, we've got all the different types of injury or illnesses. Some big ones are trauma because of the machinery they might be using on a Martian base, but also in microgravity, it's hard to predict the movement of things if you're not used to it. So a lot of trauma to the hands and eyes predicted. And then of course, anything that's common on the ground will also be common in space. And we've got those infectious surgical diseases such as appendicitis and cholecystitis. And I really did this part for my project to choose essentially which area should we target in surgery. And so I settled on targeting surgery on the limbs, and that could then be scaled up to the trunk. So moving on to the more interesting part. Here we've got the initial design that I proposed and that I then built on. So on the right, you can see here these ridges that are creating this wicking effect to collect the fluid so that they aren't floating around and they aren't obscuring any view. And here's just a demonstration to show that it will be targeted at limb surgery. Moving through systematically here, we've got part A will be a viewing window, because obviously your surgeon still needs to be able to see the limb. So that part won't have any of those ridges for the fluids to collect. And then part B here will just be those rigid end plates. The golden rule with designing anything for space is to minimize weight, to minimize size and power requirements. So currently this doesn't actually have any power requirements. And that's just because trying to fit into those requirements for anything you're sending into space. So the end plates are rigid there, and then the center will be soft plastic, and that can be collapsed down a bit like a slinky. And then down here, we've got the arm portholes. So they're just colored in orange for visualization, but they're essentially for a surgeon on one side and assistant or scrub nurse on the other side to put their hands in and access the surgical field. So I then improved on that design with some of the research that I've spoken about. And this is the final design. We've now got the gloves inbuilt because of that issue with sort of taking gloves off and getting contaminants into the cabin atmosphere. We've got a restraint table as well. So Jay mentioned using Velcro. And so these will have also some magnetic strips so that you can put any metallic items down. Another important consideration in any research on a spacecraft is that a lot of the navigation and attitude control is done by magnetometers. So any magnets that you send up are going to have to be very weak, because you don't want them to be interacting with the attitude and navigation control of the capsule that you're in. You also want it to be quite weak because you don't want it to be attracting the tools that you're using during the surgery. There's also an inner tube surrounding the limb, so you can then cut that at the point that you want to access, just to reduce, again, that contamination risk. Clips for stability, of course. Everyone's floating around, so you can clip this to the walls of the spacecraft or the ISS. And as Jay mentioned, you can then restrain the crew members. Entry ports, so down here, just some entry ports for wires, supplies, if you want to do any telemetry. Supplies, you're always going to need more supplies to be added in, sort of fresh, sterile bags. And then, of course, things are coming out, so you've got a waste disposal bag at the end. You have to remember anything you put in here might float out, so it'll have some adhesive lining and also some absorbent lining if any fluid gets in there. So this is just a quick prototype I built, but I would have to caveat it by saying this isn't flight ready. One of the other considerations you have to take in space is that any materials that you sent up can't be off-gassing because it's a closed loop atmosphere. So if you've got any off-gassing, then it could build up in the atmosphere and pose an issue for the crew members. So this was just a prototype to help with visualization. Great, well, I hope you enjoyed a brief introduction to all things space scientists have to consider, and also the gap for innovation that you can fill. And I really believe this research could not only safeguard astronauts, but could present a novel solution to terrestrial surgery in remote and extreme environments on Earth. So thank you for your attention. And if this has been interesting to you, then be sure to join the Space Surgery Association.
Great, thank you, Eleanor. Great overview of your research work, your experiences. Awesome to see that your experiments flew to the ISS already. But also on space surgery, I think this was very informative and inspiring for many viewers. Thanks for that. We have been receiving a lot of questions for you and Jay, but we'll be covering them together. So this brings us to the Q&A part of our episode. I turn to the audience now. This is your chance to ask everything you want to know about surgery in space. So feel free to put your questions in the chat box, and I'll try to moderate these. I have a question for you right now, Eleanor. So you mentioned that the availability of tools can be limited on the station. On the space station. So we've seen efforts to use 3D printing on board the International Space Station. How do you see this contributing to efforts of medical procedures on long duration missions, for example?
Yeah, I think this is definitely a really promising innovation. I think with the 3D printing, you definitely want to check that if you're 3D printing a scalpel, for example, and that kind of thing, that it is equivalent to the one that you would use on Earth. But otherwise, it's definitely one of the solutions that you can have to minimize those size requirements again. But then you would have to have the space for a 3D printer. So it's really a trade-off. And I think it is very promising, and I think they are looking at it very seriously. But it would depend on the kind of tools that you were hoping to print and what you would be printing them with. As again, there's material considerations. You can't have any materials that off-gas. And then if you want to be using magnetic strips to hold down tools, then you're gonna have to print with magnetic materials and that kind of thing.
Yes, that poses some interesting challenges again as well. And so to expand on that 3D printing technology, Ian was saying in the chat, so with the breakthrough in bio 3D printing of even tissues and organs, is flying patients to a space hospital with a bio 3D printer even being discussed, or is that too far out? And do you think it will be feasible to maybe even print some biological tissue next to tools, as you mentioned?
I think it would be very interesting. I'm not sure about, how feasible it would be just yet. I think that they haven't even really thought of a space hospital. I think the payload capacity for the medical side of things is still very small and very reduced, especially from the ISS to a capsule that will be going to Mars. You're already scaling down a lot. So they're even just right now deciding on what to send on that, and whether you send a defibrillator or another thing, and trying to make those trade-offs. So I think in the short term that wouldn't really be on the horizon. It's definitely interesting innovation. And another one they've been talking about as well is sort of printing drugs or printing food and all that kind of thing. I think keep an eye out for it in the future, but it won't be happening just yet.
Yes, great. And this reminds me of a publication recently from, I think, the UK government or the NHS, mentioning a collaboration working towards a space hospital and helping those innovations. So that'll be interesting, and we can share a link to that article after this session. But this also leads to this next question of Linda Dow from the Canadian Space Agency. Do you believe that space surgery can be analogued on the ground? So we've mentioned a couple of new technologies like 3D printing. And if so, what are the considerations you think?
I think there are already analogues without sort of building them ourselves from a space perspective. I think you'll find a lot of remote areas with limited medical capability. A lot of the doctors sort of serving those areas will have training in all sorts of trauma surgery and emergency surgery. So those are good analogues. They also have the limited supplies or have the limited access to communication, but I think they do have often the option for real time sort of talking to a consultant or an expert somewhere else that can talk them through a procedure. So that part of it you might not be able to simulate, and you wouldn't want to simulate in a sense, just because ethically it wouldn't be great to decide not to sort of contact the person that you should. The space analogues, I think you can simulate it, but again, if you're simulating, the hard thing with medical space analogues is that ethically you have to make the decision as well, that if something really does happen, then you have to be there and you have to take care of someone to the best of your ability. I think the UK analog missions are going to be looking into some of the medical considerations through an analog, I think, up in Scotland soon. So I'd keep an eye out for that. Yes,
sure. And so when we move then from analogs to space, I thought this was a great question from Chris. So I'm not sure if you have an answer to this, but what surgery or medical procedures would actually benefit from microgravity?
Oh, wow, that's a very interesting one. I think
taking it from a different perspective.
Yeah, from reading some of the literature on the Laparotomies, they actually found that because of this surface tension, any blood sort of in the cavity would pool around the edge of it. So for the abdominal cavity, then any blood that is sort of hemorrhaging pools around the edge of it. So it does actually help visualization, because the rest of the cavity then doesn't have that sort of blood that you have in surgery, which is going everywhere. So here it pours around. It also sort of covers organs, so that's on the negative side that you don't have visualization of the whole organ because you've got this sort of film of blood covering it. But I think with laparotomies, they were quite surprised with the fact that it did help in a sense.
That's amazing. That's amazing that there's even advantages of microgravity to this to these challenges. And it also led to this next question of Roxanne Fournier. She mentions because of the 10 times higher microbiological loads on the ISS, is there also work being done on developing a sort of human-sized glove box that can be used as a clean room to do surgery? So this is really a question on the size of also your project. I think you mentioned the restrictions in what you can send up to space, but wouldn't a human-sized glove box be even more convenient?
It would be more convenient, it would be ideal, but you would need the space for it and you'd need the weight allowance for it. There was a lot of talk of a trauma pod, so a whole module which would be there to perform surgery again. You need the power to fuel that, you need the space, and yeah, so it's all a balance. And obviously I'm not part of these decisions, so we can just make the proposals that we want, and eventually they'll fly what they want to. But it's definitely an idea just to have a full module that's dedicated to medical capabilities, but that's always been scaled down quite early on in the design processes of various space stations, just because in terms of how much gain you get from it, they are quite unlikely at the moment to have any serious medical events that require that. So
I was going to say, I can even imagine it's a trade-off between what's the chance that you need it at all during a mission, of course. As you mentioned, the expectation of NASA, I think one event in 2.8 years they expect. Yes, of course. So another question from Mihoko Zhang. She is asking, as an undergrad student, how could I get involved in space medical research, such as the one that you have done? And Kathleen Ryan was also wondering, well, I have that same question, she says, but then as a new graduate.
Well, I would say that the same to both of you. I definitely joined our SMLS group, because on our Slack channels, a lot of people propose projects and you can jump onto projects. Also just coming up with an idea, and really my dissertation was me going to my department heads and saying that I didn't like the list of dissertation topics that they gave us, and I was asking them if I could do my own, and luckily enough they said okay and let me run with it. It did mean obviously that I didn't have the same support that others on the course did if they had a supervisor that was an expert in that field, but I felt confident that I could run with it, and I contacted the people that I need to, and just asking the right questions and having the idea and going with it, I think I would encourage you to do. But otherwise, the SMLS is a great place to find collaborators for group projects and doing literature reviews and going to conferences as well. You can meet so many people.
Great. So thanks for those great tips. We'll be adding this information via our Twitter and LinkedIn channels, so you can find also our Slack channels. We are at the top of the hour, which means that we have to conclude this 8th episode of the Health in Space series. I'd like to give many thanks to our speakers, Jay Buckey and Eleonor Frost, for being with us today. The presentations you gave us were inspiring and gave us a good look into the now and future medical aspects of human space travel. So thanks a lot for taking the time today. If you liked this episode, check out the SGAC YouTube channel for more previous episodes and other materials, and feel free to share them on social media. As for the Health in Space series, this was our 8th session, but we are evaluating new topics for new episodes. We have a whole list of fascinating topics that come to mind when thinking about health in space. But if you have a topic that you are passionate about and want to learn more about, find me on LinkedIn or Twitter and let me know, because we like to create this series together with you, our audience. And that was it for today. Thank you again, Jay Buckey, and thanks, Eleonor Frost. And thanks for everyone that joined us from around the globe, really, and have a great day ahead. See you next time.